Welcome back to On the Beat, everyone. I'm over here with Robert White from Robert's Apothecary. How are you, my friend?
Doing very well, thank you.
That's good to hear. Well, today's topic is all about anti-inflammatories and how they've advanced over the years, and the natural ones opposed to the ones that you buy at the pharmacy, over-the-counter, prescription. Why do we use anti-inflammatories?
For aches and pains, arthritis, headache, sprained ankles, tennis elbow, any kind of joint pain, people take anti-inflammatories.
All right, well, let's break down the different types of them.
Well, we have traditional anti-inflammatories like
the Advil.
Okay. Or Aleve. Those are non-steroidal anti-inflammatory drugs that used to be prescription. And we have natural ones like turmeric, curcumin, and I have one that has a blend of 5 or 6 different ones. Boswellia is one of the better ones, the more effective ones. And for those of you who don't know what Boswellia is, that is frankincense. So,
where is that grown?
Typically in the Middle East.
Really?
And the frankincense, or Boswellia, is an excellent anti-inflammatory that does not bother the gastrointestinal tract, the kidneys, or the liver. So it has little to no side effects as opposed to the prescription or the over-the-counter ones that possibly can have side effects.
So the difference between over-the-counter and prescription, are they different strength? Are they used for different types of anti-inflammatory?
They would be different strengths. We have still prescription strengths in the ibuprofen or naproxen that are a good bit stronger than what's sold over the counter.
All right. Now, I'm sure there's some type of side effect. There's always some type of side effect for most things.
Yes. The traditional ones, if taken every day on and on and on, can cause some gastric lining erosion, leading to gastrointestinal problems. You can get kidney damage from chronic use. Some of these can adversely affect the liver. Doesn't happen with everybody, but in some patients.
Is the natural remedies, will they counteract with our other prescription drugs that we may be taking from our GP?
Well,
for other issues for our body?
If a physician has prescribed an anti-inflammatory prescription strength,
yes,
and patient comes in, wants to fill that prescription and take that by itself, that's fine. But if they want to, if they ask about one of these natural remedies, I will tell them they can take one or the other, but we don't need both together.
Robert, in general, where do you stand in your philosophy between prescription medication and natural remedies? Just out of interest.
Well, when a patient comes in with a prescription from their doctor for an anti-inflammatory drug and that's what they want to take, I fill that prescription, have no problems at all with that. If another patient comes in, been to the doctor, has the same prescription, said, I don't want to take this because I've got a friend who took it and had stomach ulcer,
right,
and what else do you have that maybe won't cause me to have side effects?
So that's when you go to the natural remedy.
Right.
Well, Robert, we appreciate you. We're going to dive even deeper with more of our conversation. We appreciate you for coming in. If you want to find out more about Robert White, all his website and phone numbers are all on the screen, everyone. Robert's Apothecary. Go in, give them a chat. They're so easy to talk to. You're watching On the Beat.